India has raised surveillance after a scare from China. States have been told to review the hospital setup. Here's what's been happening in our neighbor nation right now. And this is not to alarm the viewer watching this telecast right now, but to update you what's been happening. Is there a possible COVID return or another sort of disease that is emerging in China? It's a big watch for a flu among children, specifically for the category of the age group of children. In China, there is a fear of an emerging flu, pneumonia, and the COVID-19, which is the coronavirus spread. Now, according to a health ministry here, there's no need for alarm just yet. China, however, is reporting a respiratory illness spike. So there's been an increase in cases, specifically of respiratory issues, and those affected are primarily children. A flu and a pneumonia kind of a disease is escalating. States have been told to review the hospital setup already to be better prepared. And of course, we will be hopeful and praying that we do not have to start 2024 on a note of a disease. But there is a scare coming in from China, so surveillance has been increased in India too. There are hospitals in various parts of China that are reporting full capacity and children reporting heavy issues with flu and pneumonia. Now, what kind of flu is this? Is this what normal flu that is known to impact children and civilians, or is this something more? We're trying to get more details, but as visuals are emerging, and remember from China, information is always hard to be released. It's not easy. It's a heavily monitored country by the government. Just like in COVID-19 pandemic, even now the information is very slow and difficult to be coming out, but it is very clear that something is unfolding in China and India is keeping a watch. Take a look at this report that we have prepared for you from the initial information that has come in. There has been a surge in children hospitalized for undiagnosed pneumonia and symptoms of respiratory illness. India is not letting its guard down. Here's what's happening.
Four years on since the COVID-19 pandemic first broke out, and a horrible sense of deja vu. China once again is hogging world attention for the wrong reasons. This time around, reports of pneumonia-like illness in the northern part of China, Beijing and Liaoning, has got the world's attention. And rightfully so. Exactly 4 years ago, similar information from Wuhan province in China had emerged, or should we say, was by and large concealed. The outbreak turned out to be that of the novel coronavirus that led to the global pandemic that we are still dealing with. This time around, these videos and sketchy information reflect an outbreak in children. The World Health Organization has said that China has indicated that there is no unusual activity in spite of the fact that infections amongst children is only increasing. China, in fact, has told the World Health Organization that it could be because of circulation of pathogens which is seen during this time of the year, or maybe because of pneumonia, possibly because of lifting of COVID-19 restrictions. But why just children? What about the videos that are doing the rounds of hospitals and clinics getting completely inundated? There are several questions that remain unanswered. The World Health Organization says that they are, in fact, monitoring the situation very closely. And this time around, China has been communicative.
Presently in the China, what is happening? See, a lot of children are getting hospitalized because of pneumonia. And so far, the organism what they have identified looks like it is a mycoplasma pneumonia. So mycoplasma is an atypical pathogen which is seen mostly in the children which are more than 5-year-old school-age going children, not in small infant or younger children. So in those cases, we see symptoms like gradually increasing fever, gradually progressing cough, poor appetite, not taking feed well, and sometimes manifestation outside the lung as well.
The World Health Organization has alerted member countries and underscored that this time around, China has kept the world body posted.
Pediatricians in our country are seeing children with fever and sore throat as always. There is no discernible rise in the numbers. Pediatricians say that they have not seen anything unusual in India at this time, and mycoplasma cases are not currently being reported. In terms of precautions, children who have fever, cough, or symptoms of a cold are advised to stay away from school and also not to mingle in social gatherings.
This outbreak's severity has also led to the suspension of classes in some schools as students and teachers have fallen sick, a situation very similar to the early days of the COVID-19 outbreak. In New Delhi, Sneha Mordani for India Today TV.